part of the thinking about changing, as you commented, changing what food is eaten, and then comment about sugar, I mean, it really is like a supply-demand type of model, I think, and I taught kids from South LA nutrition for about 5 years as part of a research study at the USC, but I really saw how there were definitely parents that were preparing healthy meals, but because of media and all of the influences, the kids have developed very fruit and vegetable aversive palates. And so one thing I'm really convinced that we do need more education at a younger age.
Right.
And I'm working with Olivewood Gardens and Learning Center National City. I don't know if you've heard about us, but if we can, we're trying to do a rigorous evaluation and see can a however many week-long program with hands-on garden where they harvest produce and then they cook and prepare it, can that shift their taste preferences? Can it increase their fruit and vegetable consumption and then ultimately reduce risk for obesity? So there's, if you guys want information on that.
Oh, yes.
Okay.
Okay. I'm going to, one more.
Are some of these funds earmarked for community gardens where people can,
Yes.
are there sites and, is there places for people to get involved as a community to donate their time and services to facilitate these things going on? I have a large core group of volunteers that would commit to something like that, but we don't know where to go.
Oh, yes, we'll get you all the information. No, there are programs that are, areas that are earmarked. And so I will most definitely get your information and provide you, with some information on who to contact. And then also my information is up on the screen, so if you want to feel free to contact me, and maybe I can connect you, like you're saying, should you contact for their area in regards to...
Oh yeah, that would be a great place for a garden.
Okay, I'm going to turn mine over to Julianne, and she's talking more specific to what's going on.
And I'm with the San Diego County Childhood Obesity Initiative. And I'm going to try to pull together how public health and food justice work, and then what is our vision for a sustainable food system in San Diego, and why is it so important to the obesity epidemic. And I think that there will be an opportunity to answer a lot of the questions that I've heard from the audience. Not sure there will be enough time to answer all questions, though. The Obesity Initiative really got started based on the premise that Rhonda talked about, the social determinant of health, realizing that if we were really going to address this issue in a comprehensive manner, we needed to focus on policy and environmental change, and then just looking at the pure statistics in San Diego. We are a public-private partnership whose mission is to reduce and prevent childhood obesity in San Diego, again, by advocacy, education, policy development, and environmental change that really supports a healthy community environment. The numbers that really sparked this movement in San Diego County is, you've heard the obesity epidemic in the United States. It's about 18% of the population, depending on who you're citing for that figure. That's quadrupled 4 times since the 1960s. In San Diego, it's 1 in 4 children are overweight or obese. That really depends based on where you live. Like Rhonda was mentioning, if you live in Encinitas, the likelihood that your child is overweight or obese is about 13.9%, where in a community like San Isidro, it's almost 40%. There's definitely an issue of equity and resources that really helps promulgate those numbers. A lot of things have happened in the United States since we've really had this rise in obesity. We're talking about 1/3 of the population of kids from 2 to 18 now have high cholesterol rates. They're now encouraging physicians to start checking blood pressure at age 2 and high cholesterol rates at age 5. If you have a history of high cholesterol, they're recommending that you start checking that at age 2. So we definitely have an issue. Again, based on that, really it was our county board of supervisors who came together in San Diego County who identified that childhood obesity was a major problem that San Diego was going to have to face. we're facing a lot of healthcare costs related to it. On an annual basis, we spend about $3 billion in San Diego related to overweight, obesity, and physical inactivity. It requires time away from work. It draws on families' resources. So they really wanted to make sure that we address this. But at the same time, they wanted to build on the work of an organization called the Coalition on Children and Weight San Diego. This was a grassroots group that got started in 2002, and it really brought everyone together from public health professionals to parents to physicians who just wanted to be involved in changing this issue. At the time that they got started, I don't know if they necessarily thought that they were going to be a cutting-edge organization, but they really took a different approach. Again, they didn't focus on individual behavior change so much. They really looked at how they could reshape environments. They focused primarily on two environments, and that includes childcare and school settings, and encouraging them to really support kids in making healthy choices by encouraging adequate time for physical activity or making healthy foods available to them, pulling out some of the vending machines, making sure that they have healthier content to them. So they decided, the County Board of Supervisors, to really build on that model, but at the same time, they knew it had to be much more comprehensive if we were going to address this. We needed all sectors of the community really participating in obesity prevention efforts. So what they did was they pulled together a steering committee of local experts on public health, nutrition, physical activity, and they really did a year-long review of what's taking place across the nation. So they talked to cities like Chicago that are doing very innovative work, really focused around policy and environmental change. They talked to public health professionals, what were they facing in their daily jobs. They also talked to individuals in the community just to ask them what were the daily barriers and supports to being able to participate in nutrition and physical activity. After a year, they realized that there were 7 key sectors of the community that had the greatest impact on childhood obesity, and that, again, if they really were going to address this issue, they needed to focus on policy and environmental change. So they developed the Call to Action San Diego County Childhood Obesity Action Plan, and this identifies each of the 7 sectors, which is government, healthcare, schools and out-of-school programs, early childhood, community, media, and then our business community. And they identified key strategies that they could participate in to really change our environment. So examples of those is my organization, after that year-long process, they decided, like any other action plan, it was just going to stay on the shelf if they didn't institute an organization to really carry it through. So they contracted with community health improvement partners, collaborative healthcare organizations throughout San Diego County, to take on this work. And they developed my organization, the San Diego County Childhood Obesity Initiative. So we developed work groups in each of those 7 areas identified by the action plan to really bring together professionals and advocates into one place to really share what's already going on, what can you do, what are the opportunities, and how can we better partner together to really solve this issue. So some examples of what those activities look like are in the government domain, as Rhonda was talking about. We have each of our domain is actually spearheaded by a community partner or volunteer. So it's chaired by both the county public health and then our Parks and Rec department in San Diego County. And they're really looking to bring land use professionals and public health professionals together to talk about how can we incorporate urban agriculture into our design. How can we build more walkable and bikeable communities? How can we move people outside of their vehicles? Also, as Rhonda mentioned, there's vending machine policies on county property. They're really trying to model the health practices that they want to encourage the public to participate in. Our healthcare is looking at how can we better surveil this issue in San Diego. How can we really encourage physicians to advocate for changes, whether it's at the school board or within their own practice? How do they deliver messages that are appropriate for their patients? And then also our schools and out-of-school programs, looking at everything from wellness policy implementation, helping the 42 different school districts throughout San Diego County really carry that out. And if you're not familiar with wellness policies, basically they were stipulated as part of the 2004 Child Nutrition Act. And basically any school that participates in the federally funded meal